Thank you very much, Minister Cox, Minister Diyal Singh, Dr. Hines. Excellent presentation. Good morning, members of the media, wider viewing and listening public of Trinidad and Tobago. This morning, my task is a simple but an important one, and I think I'd like to just pick up where Dr. Hines has left off. The first point the government would like to make is that all of the measures that we have taken and all of the measures that we've put in place, all of the measures that we've asked you all to pay attention to and listen to and take heed of, as touched on by Dr. Hines and all of our other medical personnel, the Minister of Health over the last few days, in particular the Prime Minister as well, are done to protect the population of Trinidad and Tobago. It is important that you understand that principal concept, that all of these measures are to protect you, the population who are here in Trinidad and Tobago. If anyone can find a way to get through the barriers that we've put up, and these are not police barriers, these are not national security barriers, it comes down to social, personal responsibility barriers. If persons get through those barriers, it compromises the protection that we are attempting to put in place to protect you, the people of Trinidad and Tobago. And in particular, what I'd like to focus on here is our decision to close our borders. Our decision to close our borders was not one that was taken easily or lightly, but it was one that was taken on medical expert advice. Borders across the world globally are being closed, and they're being closed for a reason. Exactly what Dr. Hines just spoke about. The contact spread of this virus is real. Yesterday, I watched a video of someone talking about what happened in South Korea, and that it was one woman in South Korea that led to the spread of 80% of what then took place in South Korea through exactly what Dr. Hines just pointed out to us. So our decision to close our borders was a very considered decision, and one that we intend to uphold, as I said yesterday. This morning, as I looked around the globe, I just want to point out a couple of things to us, the population. The Olympics, the largest sporting event every 4 years, is finally going to be delayed, probably until next year. We see what continues to happen in Italy, because they did not, unfortunately, take the types of measures that we have taken earlier. But these measures can be easily defeated and affected by persons who take decisions to breach what we're asking you to do, to stay at home, as Dr. Hines said, unless it's essential, you have to go to work, and to limit your social contact. But back to the borders, you see what's going on in the United States, in the United Kingdom. In the space of 24 hours, last time we were speaking, we were talking about the Prime Minister of United Kingdom shutting down bars. It has now come to do not leave your house unless you have essential business to attend to go to the grocery, to the pharmacy. A country with a population that size taking such a decision is the strictest of measures. We do not want to get there, and it is up to us to take the right personal decisions. The same thing in the United States. You're seeing them now scramble and trying to get medical supplies to different states. You saw them yesterday pleading to the government, the central government, asking them to step in and to stop the price gouging taking place with limited medical supplies. They didn't shut their borders early. We shut ours. These are the reasons why. I found it interesting on the BBC. British travellers stranded in New Zealand and Australia. Quote, travel lockdowns mean hardly any normal flights remain. These are the things taking place across the globe. Singapore have closed their border to all visitors. New Zealand will enter into a full lockdown from the end of the week, when only essential services will be open. This is a global pandemic. This is not about Trinidad and Tobago. Jordan has imposed an indefinite curfew that bans people from leaving their homes under any circumstances. The sensible people in Trinidad and Tobago amongst us are heeding our call. This is why we have shut down our borders, to protect the people who are in Trinidad and Tobago. With every importation of people inside, it expands the risk, exactly as Dr. Hines has just pointed out to us. So now I want to get to the specifics. And now is a call as well. When we ask for everybody to be personally responsible, it must include you, our friends in the media, because you are the ones at the end of the day we're hoping to get the messaging out there. The rest of the population is looking to you, the members of the media. We are looking to you as a government for your assistance in getting the messaging right. I woke up this morning. Of course, we have some citizens who are in different places. All right, let me start with Margarita. So I woke up this morning and saw at 3 o'clock a story in one of the daily newspapers about a Mr. Jagdish Pramsuk, who is described as one of the 70, I don't know how we got to the 70 now, citizens stranded in Margarita, Venezuela, who are pleading to be brought home. The government of Venezuela took a very early decision to shut not only their borders, but to start asking people to stay indoors. There is a reason for that. The same reason Dr. Hines was just pointing out. And this gentleman is using the media here today to sell a story as to why he should be allowed in, why he should be the one to break the borders and to be permitted back into Trinidad and Tobago. What he did not tell you is that he's a resident of Venezuela. What he did not say in 2010 is when he applied for his passport in Caracas, Venezuela, under residency and where he lived, it was Venezuela. What he didn't tell you is he has his Venezuelan ID card. These are the types of things that are irresponsible. We have shut our borders to protect all of you here, to protect all of our citizens in Trinidad. I understand that people are going to be running to the members of the media. That's how it goes. They're going to be giving you all stories for you to run with. The government is going to hold fast to protect the rest of the population. That's the first one. The second one is the unfortunate 35 citizens who are now in Barbados. You all would recall some time ago the government announced a decision. We are locking down our borders to non-nationals. Non-nationals, you can't come in. That is one step. That is a clear signal for our nationals. If you're outside, hurry up and get home. It's a clear signal that we're limiting now the same contact spread that Dr. Hines spoke about. It doesn't mean we're going to leave our borders open indefinitely. The only way a country has a chance to beat this and to keep the curve down is to take some of the difficult decisions and the measures that we have done on the advice of our medical experts, our Minister of Health, with the Minister of National Security, Prime Minister, and the rest of the Cabinet. So when we shut our borders off now to nationals, it is not something that we wanted to do. It's not something that we take pleasure in doing. But the reason for it is to protect you, the remaining population in Trinidad and Tobago. And every person that we allow in now presents a risk potentially. We announced no non-nationals in, when was it, last week sometime. There were still available flights all over the world to make your way back. Yesterday, I spoke to the government of Barbados. I spoke to Prime Minister Motley and her Attorney General, and it was a very CARICOM conversation. And I emphasize what our position was as they understood. I haven't seen it reported anywhere that Barbados already has in place a mandatory, we haven't put in place a mandatory self-quarantine or quarantine period of 14 days. The Prime Minister of Barbados and the Attorney General point out Barbados has a mandatory self-quarantine or quarantine by the state for 14 days. That is their attempt to try and protect their population. They understand what is taking place. We went a step further and we closed our borders. Not because we want to keep any Trinidadian out. That is not the reason. It is to protect those who are within our borders now. I have to say, I found it a little disappointing to receive a short while ago a question from one of people in the media asking me, these people in Barbados, they've obviously been in contact with them. They put in a hotel. That was part of my discussion yesterday with the Prime Minister of Barbados and the Attorney General of Barbados. They said they would do what they can to make our people comfortable. They have to apply to the strictures of the 14-day mandatory quarantine in Barbados. I am being asked now today by the media whether we in Trinidad and Tobago are going to foot the bill for these people at a hotel in Barbados. The population of Trinidad and Tobago understands what we're faced with. The population of Trinidad and Tobago understands that we did not command or ask anyone to leave Trinidad and Tobago and not make their way back here. Everybody took personal decisions. The people who have gone out and weren't able to make their way back in, we feel empathy towards you. We honestly do. But the duty of the government, which we are very clear about, is to protect those who are here in Trinidad and Tobago and to uphold our decision to close the border. It was also just brought to my attention a short while ago, and the Ministry of Health, in keeping with their promise to the nation, put out their press release giving us the statistics and the information as to what is happening with COVID-19. We just got a presentation from Dr. Hines explaining to us about primary contact. As we were sitting here preparing for this conference, a media house reading the latest release from the Ministry of Health, where they say the second case that was confirmed yesterday was someone who had primary contact. What that means is the imported person came back. It is a family member in the household. That is primary contact. Rush out with headlines. And these are the types of headlines that can create panic. And what we need to avoid. Splashing everywhere. Community spread starts in Trinidad and Tobago. First case of community spread. The use of technical terms is very important at this stage, people. The government is doing everything it possibly can in a most responsible manner to provide the population with the information. The release said primary contact. Primary contact means within household, within family. It does not mean community spread. So for the media to rush out and try this community spread, and one must ask why. We're all in this together. We need the media. We are asking you all, work with us. Let us be responsible, because now is when the media will help the rest of the population to get the right information. And that information from the government's perspective continues to come from the Ministry of Health and the Ministry of Communication, who are doing a great job. So please join with us. Be part of the personal social responsibility that we're asking for. We are not going to allow the exemptions to the borders. I want to touch on the last thing that the Prime Minister said, the Honourable Prime Minister said yesterday, when he talked about the returning and the repatriation of our students at UWI in Mona and in Cave Hill. In planning or shutdown of the borders, that was always part of our process. The Prime Minister spoke, the Chair of CARICOM, we are putting those things in place. They have students from Barbados, Jamaica here, etc., and we're going to do that. But it has to be done in strictures with the medical experts overlooking it. That was always a condition of us shutting our borders. It is not an exemption that is now open for everybody else. For unfortunately our nationals who are spread all over the globe, our message to you, stay put, be safe, be responsible wherever you are. But this government is resolute that we will continue to protect the population of Trinidad and Tobago that are here by upholding the measures that we've put in place. The Minister of Health touched on our receipt this morning of the 4,000 kits, testing kits for COVID-19 from the People's Republic of China. We also this morning received the 15 thermal scanners that they've promised. The national security will position in certain key places throughout Trinidad and Tobago, because our cargoes, we still have to be able to receive cargo via air and via sea, and there's still that industry taking place. So they will be positioned at our ports and anywhere else that the Ministry of Health would like us to position those 15 thermal kits. We thank the People's Republic of China. I just want to end this part of my contribution by saying the government will continue to do all it has to in very difficult times and circumstances in a global pandemic. I think that point sometimes is lost on us, of when you look and you see what is taking place globally. Fortunately, so far, and it can change very, very quickly, as we saw with the 70 people who were on the cruise ship that came in. Immediately that takes up your resources. So it can change very rapidly, which is why we shut down our borders. Please work with the government, who are going to do everything we can, balancing our resources, balancing our respect for people and the population, with a clear mandate that we have to protect the population that remain in Trinidad and Tobago. And we will do what we have to do to achieve that. So it comes back down. We've been receiving reports. I have received a bundle. I'm sure I have the CMO, the Minister of Health, this morning, about people all over. The CMO told us yesterday about 19,000 people coming in the last 3 days. We've asked you to self-quarantine. I'm receiving reports of persons that came in and they're not self-quarantining. Exactly as Dr. Hines showed us just now. Even when you self-quarantine, your family members as well. Stay put, as you heard the Prime Minister. Increase your personal hygiene in your space. But please, if you've been asked to self-quarantine, we have allowed you back in the country. We didn't go the mandatory quarantine. Follow it, as you've just seen how quickly one person can spread that amongst us. As this far, and it will change, I'm sure, but we're hoping it doesn't. There's no community spread. So please, everyone, exercise your social responsibility, the social distancing. People who've returned from abroad, stop mingling. Stay put. Stay home. I've looked at some of the cries and the pleas from Downing Street by the Prime Minister of the UK. Unfortunately, our Prime Minister was ahead of those decisions. But to watch him, the Prime Minister of the United Kingdom, yesterday, telling his country, stay at home, only go out for essentials, it brought a chill. So people, the government's message is, please be socially responsible. Please help us to protect you, because that's all that we're trying to do. Thank you.
Thank you very much, Mr. Young. Ladies and gentlemen, we are open for questions. Please identify yourself.
Good morning, Crystal Wilson, TTT Limited. We understand the call for people to stay home. Public servants are asking, what about them? What's in place for them? Other question is regarding daycare facilities. I understand some of them are still in operation. Does it matter the number of children, or are you all asking that they not function for the time being?
With respect to the first question, government ministries, so for example, the Ministry of National Security, and I know some others, have already begun addressing that question. So at this stage, it is about social distancing in workplaces, not only government ministries. We have started rotation of staff in other areas of national security, immigration. You would have heard some of the measures we've put in place yesterday to stop the influx of the public into office spaces. The Attorney General, in the passage of legislation last week, we also passed legislation, for example, people at licensing office, people at the company's registry. With respect to our public servants and workers, they are not left out. The government continues to take the advice from the Ministry of Health and our medical experts as to what are some of the things that are to be implemented that can minimize. We still need to function, and that is what we're trying to do. The essential services continue to be needed. We recognize as well, especially at this point in time, with persons who may be losing their jobs, etc., that the government's role is increased, that we need to have that outreach in the social aspects of helping persons. So we will continue to do all that can. I was pleased this morning to see that the Minister of Finance had sent to the Prime Minister and myself, we had a discussion over the weekend about NLCB lotto outlets. And they sent out a pamphlet, and they've put markers on the ground, or they're supposed to outside for people to know where they can stand in line. So these are some of the things that are taking place, and it just comes down to common sense, listening to our medical experts at the end of the day. But it is subject to change. This thing changes, as you all would have realized by now.
Okay, on the issue of nurseries and children,